welcome to
Soul Sessions. Thank you for joining us for this episode. Soul Sessions Through the Eyes of Us is a safe space for the panel to discuss various local and global events and provide information on current topics that affect African Americans. Disclaimer, the opinions voiced on this program do not necessarily reflect the views or opinions of the AFCC, its staff, volunteers, board of directors, or underwriters.
Hi, I'm McKenna, the Community Engagement Coordinator at the Center.
And I'm Marlo Hatchett, one of the peer mentors at the Center. And today we're going to be discussing the new bill for the Mental Health Crisis Hotline. Lawmakers want to secure funding for the new Mental Health Crisis Hotline, 988, which will serve as an alternative to 911 and aim to avoid unnecessary police confrontations.
Jonathan Morello, 23, was shot and killed by Los Angeles police moments before the arrival of mental health specialists who had been sent to respond to reports of a possible assault at the location. A family member at the home had told police Morello was armed with a knife and possibly under the influence of narcotics, according to the police.
The type of fatal interaction Morello had with the police is what lawmakers and advocates hope to avoid with the creation of a new national 3-digit mental health crisis hotline. The National Suicide Prevention Lifeline, which uses the 10-digit number 800-273-TALK or 8255, will soon be referred to as 988. The goal is to reduce violent and deadly interactions between law enforcement and those experiencing mental illness.
The 988 hotline is supposed to be expanded by July, but Representative Tony Cardenas, D. California, realized after Morello's death near his district that many cities in almost every state lack adequate resources to effectively implement it by then. In order to address that challenge, Cardenas introduced new bipartisan legislation Thursday to help states with additional federal funding and guidance on how to create a crisis response system that relies on trained mental health specialists instead of armed officers.
What we're going to have with 988 is the same thing as 911, but for mental health, for people with drug addictions and people who are contemplating suicide. Cardenas told NBC News. The perfect situation is that states will start implementing the resources, the funding to keep it going every day, every week, every month, every year, just like local states and communities do that now with 911. At the same time, 988 will be there to make sure that we have a mental health professional to be there, to take that call, to respond, and to make sure that someone comes out there, he added. And then when they need help long term, that there's some place for them to go to get that help.
More than 1 in 5 people are fatally shot by police have mental illnesses, according to Washington Post database of fatal U.S. shootings by on-duty police officers. Since 2015, police have fatally shot at least 1,569 people with mental illnesses. Then, President Donald Trump signed into law a bipartisan bill before leaving office in 2020 to replace the National Suicide Prevention Lifeline with a 911-like mental health emergency line.
Representative Seth Moulton, Democratic Massachusetts, first introduced the bill that helped make the 988 mental health crisis hotline a reality, a move he said was a critical step towards destigmatizing mental health and making care more accessible. Now he is co-sponsoring Cardenas' bill to improve the hotline's implementation. The United States is facing a mental health crisis, made worse by 2 years of pandemic-induced trauma, Moulton said in a statement. We're long overdue to provide this service to Americans looking for a reliable, free place to turn during mental health emergencies.
The 988 line comes at a time when suicide rates have increased by 33% in the last 2 decades, particularly among young people during the COVID-19 pandemic, according to the Cardenas office. Representative Janie Raskin, DMD, whose 25-year-old son, Tommy, died by suicide a week before the January 6th insurrection, said in a statement that he is proud to help introduce the 988 Implementation Act to give our people a lifetime in their most difficult times.
People with untreated mental illnesses are also 16 times more likely to be killed by law enforcement, according to the national nonprofit Treatment Advocacy Center. This risk increases for people of color, particularly among Black and Indigenous people, as well as Hispanic men, who are more likely than white people to be killed by police, according to a study published by the Journal of the National Academy of Sciences.
We're spending 23% more per call when it's a mental health call, when we shouldn't be sending out the police or a paramedic. What we should be sending out is a mental health professional, Cardenas said. This will be saving the taxpayers money in the long run, and it's going to save lives. Families are not going to be in distress and in stress because there's going to be a better outcome for everyone, he added.
In his district, Isaiah Cervantes, 25, was shot by a Los Angeles sheriff's deputy and left paralyzed 1 year ago within 40 seconds of police entering the home, Cardenas said. Cervantes had reportedly assaulted his mother and a crisis counselor who was assisting him with his mental health issues, according to the Los Angeles County of Inspector General. Deputies reported Cervantes was killed after he gouged a deputy's eyes while attempting to remove the officer's firearm from his holster.
The Los Angeles County Office of Inspector General found that a team of mental health specialists was not asked to respond because the emergency call was coded as a family disturbance call and not a mental health related call, even though the caller specifically mentioned that Cervantes was having a mental health crisis and requested to be taken to a hospital. It was a terrible outcome. It should have not happened. And with a 988 call, those outcomes are going to start to diminish, Cardenas said.
According to the congressman's office, his bill had been deemed a priority under the White House's unity agenda, consisting of policies where there has historically been support from both Republicans and Democrats. The office also said that appropriating committees are looking forward to following through with the funding.
Representative Brian Fitzpatrick, RPA, who also serves as the co-chair of the Bipartisan Addiction and Mental Health Task Force, also voiced his support for the new bill, saying in a statement, "Now more than ever, it is imperative that we provide crucial support and expand resources for the millions of those struggling with mental health in our country." The new bill also includes language that helps harness mental health insurance coverage through Medicaid, as well as requiring all health insurance plans to cover crisis services, Cardenas said.
Additionally, it includes a roadmap to promoting mental health care jobs by supporting crisis workforce development with increased funding for training and scholarship opportunities, as well as ensuring accessibility to non-English speakers.
Suicide is an epidemic in the United States. Suicide rates in this country are at their highest levels since World War II. In 2017, more than 47,000 Americans died by suicide, and more than 1.4 million adults attempted suicide. This crisis is disproportionately affecting at-risk populations. More than 20 veterans die by suicide every day. And then there are the disturbing trends related to young people who are in crisis. More than 1 in 10 young adults report having suicidal thoughts, a 47% increase since 2009. And in particular, LGBTQ youth contemplate suicide at a rate almost 3 times higher than heterosexual youth. And more than 500,000 LGBTQ youth will attempt suicide this year alone. This is heartbreaking and alarming. But we can do something about it. One step is to help ensure that our friends, family members, colleagues, and neighbors in crisis can easily access counseling when they need it the most. To that end, there are counselors available to help today at the National Suicide Prevention Lifeline, and you can reach them by calling 1-800-273-TALK. But a recent report from FCC staff found that an easy-to-remember 3-digit nationwide phone number would make it easier for those in crisis to connect to the support they need. And so the FCC has officially begun to explore establishing 988 as that 3-digit number. After we review public input on this idea, we hope to move forward and make 988 the national number for suicide prevention and mental health crisis services. In the meantime, be sure to remember that services are available now at 1-800-273-TALK. Our hearts go out to those who are struggling, and we hope to move as quickly as we can in order to help them get the help they need and deserve.
Imagine for a moment that a fire breaks out in your home, and in this reality, 911 doesn't exist. You might call the fire department directly, but they're not equipped to come to your location and only put out fires at the fire station. And the only people that will come to you in the community are the police, who, though well-intentioned, are meant to provide a very different type of public service. This lack of a fire-specific response seems ridiculous, right? Of course we should have targeted services to respond to life-threatening emergencies, whether that's fire, law enforcement, or physical health. However, in many communities across America, life-threatening mental health and substance use crises are treated as an afterthought, receiving a response that's not specific to their unique needs. A 911 call dispatches the police, who most often bring the patient to a medical emergency room or jail, or allow them to remain in the community but without assessment, treatment, or support. We have a patchwork system, made up of elements designed for other purposes, that doesn't have the capacity to treat the most vulnerable in our communities, even though an estimated 20 to 25,000 individuals in crisis go to emergency departments every day in the US. So how can we improve? The only solution to delivering crisis care worthy of our communities is to build a structure specifically for mental health, substance use, and suicidal crisis that is on par with other emergency systems, like we do for medical, fire, and law enforcement. By integrating 3 core elements, we can replace the patchwork fabric of our crisis care and develop a true safety net that can serve everyone, everywhere, every time. And in the process, we can reallocate wasted financial resources to places where they can have a deep community impact. It starts with regional or statewide crisis call hubs. Call, text, and chat lines staffed by trained professionals who answer the call every time and direct people to the level of care they need. The onset of 988 is a great start. However, it will need to be supported by technology that empowers 988 to become an air traffic control for mental health and substance use crisis, enabling real-time coordination across the care spectrum. But a comprehensive crisis network cannot be built with only crisis call hubs. Additional services are necessary to ensure that a unified system of care is available when and how people need it. Services like mobile crisis outreach teams, 24/7 non-law enforcement mobile teams that go out in the community and deliver care to people wherever they are. This lessens the burden on law enforcement during situations where they're not needed and eliminates the anxiety people feel when a uniformed officer knocks on their door. And facility-based crisis receiving and short-term stabilization, facilities that say yes to every person that walks through the door, regardless of their level of need, allowing them to bypass the medical emergency departments. This not only provides specialized care to these individuals with less waiting, it also enables medical emergency departments to focus on the patients they're trained to serve, while drastically reducing wall time for police when transportation by police is warranted. With these core elements in place, mental and substance use healthcare can move out of the shadows and into the mainstream. Together, we can build an unbroken system of care that connects patients from the point of crisis to the level of care that's right for them. To learn more, visit crisisnow.com.
If you or someone you know is suicidal or in emotional distress, contact the National Suicide Prevention Lifeline. Trained crisis workers are available to talk 24 hours a day, 7 days a week. Your confidential and toll-free call goes to the nearest crisis center in the Lifeline National Network. These centers provide crisis counseling and mental health referrals. And the number, once again, is 1-800-273-TALK or 8255. And they also have a live online chat at suicidepreventionlifeline.org. And then you can also look at Butte County Mental Health as well. They have a crisis hotline. And then you can also give us a call here. We have a behavioral health counselor too if you are looking for any counseling services. And yeah, this also happens in Butte County as well. I know it mostly said LA County and stuff, but as we know, we just went to the protest for Desmond Phillips.
Right.
And he was going through a mental health crisis, and he was killed by Chico PD. So this is needed. We really need the 988 number. So yeah, if you can look into the bill and get educated on it and stuff, we can make it happen.
Definitely. It's definitely something that's needed and could save lives all around.
And now we're going into the lead portion of the show with McKenna Malcolm.
Hi, my name is McKenna. I am the Community Engagement Coordinator here at the office, as well as I'm a part of the LEAD project. LEAD stands for the Leadership in Equity, Action, and Development. The goal of the LEAD program is to promote and protect a tobacco-free lifestyle for all Butte and Yuba County residents. We believe passionately in advocating for health equity and environmental justice for low-income people and in communities of color. Our objectives: number one, resisting targeted price promotions. The tobacco industry spends millions of dollars annually on targeted advertising. Low-priced products and coupons contribute to high smoking rates among people of color and low-income communities and make it easier for youth to become addicted. Number two, developing an upstream approach to tobacco control. By including tobacco control in general plans and other municipal codes, we protect communities from exposure to tobacco products and help to prevent a poor health later in life. We believe limiting exposure to tobacco is an environmental justice issue. Number three, growing community advocates. We support and empower youth and young adults to fight back against the tobacco industry. In today's news, on March 28th, Walmart Inc. will stop sales of tobacco products in some of its more than 5,000 stores across the United States, the world's largest retailer said on Monday.
The company did not disclose how many stores would be affected by the move, but said it would not be exiting the category entirely. The markets in which cigarettes are being removed from stores include California, Florida, and New Mexico, according to the Wall Street Journal, which first reported the news. Walmart has rolled out a design with more self-checkout registers and other items such as grab-and-go food or candy near the front of the stores in place of Marlboro, Newport, and other tobacco products, the Journal reported.
CVS in 2014 became the first U.S. drugstore chain to take cigarettes off the shelves, while Walmart halted sales of e-cigarettes in 2019 and electronic nicotine delivery products in its U.S. stores a few years later due to its growing regulatory complexity and uncertainty. The decision comes amid internal debate at Walmart, as the retailer aims to grow into the health service market, the newspaper reported. Health officials have said that cigarette smoking causes about 1 in 5 deaths in the U.S. each year, and public health advocates have called for retailers with pharmacies to stop selling tobacco products. Most of the country's $95 billion in cigarette sales in 2021 happened at gas stations and convenience stores, the newspaper reported, with Walmart and other retailers representing about 40% of cigarette sales.
Walmart isn't the first national retail chain to stop tobacco-related sales, though it's the largest, according to the Associated Press. Target stopped selling cigarettes in 1996, and CVS Health stopped in 2014. Several Democratic U.S. senators have urged Walmart and several other retailers to stop selling all tobacco products. Decisions about removing cigarettes at Walmart will be made on a store-by-store basis, according to the particular market, the company said on Monday.
We are always looking at ways to meet our customers' needs while still operating an efficient business, Walmart said in a statement to the AP. As a reminder, smoking leads to disease and disability and harms nearly every organ of the body. More than 60 million Americans are living with a disease caused by smoking. For every person who dies because of smoking, at least 30 people live with a serious smoking-related illness. Smoking causes cancer, heart disease, stroke, lung disease, diabetes, and chronic obstructive pulmonary disease, also known as COPD, which causes emphysema and chronic bronchitis. Smoking also increases risk for tuberculosis, certain eye diseases, and problems of the immune system, including arthritis. Secondhand smoke exposure contributes to about 41,000 deaths among non-smoking adults and 400 deaths in infants each year. Secondhand smoke causes stroke, lung cancer, and coronary heart disease in adults. Children who are exposed to secondhand smoke are increased risk for sudden infant death syndrome, acute respiratory infections, middle ear disease, more severe asthma, respiratory symptoms, and slowed lung growth. So not only are you harming yourself by smoking, but you're also harming those around you by smoke clinging onto your clothes, which can cause secondhand smoke, by it going through the vents. When you live in an apartment complex, at least 33% of the residents are exposed to secondhand smoke just from cigarette smoke and tobacco products, smoking and clinging to the walls and the carpet and going through the vent. So if you are smoking, please don't. But if you are, please go outside so you're not harming those around you. And this has been the lead portion for today.
And we would like to remind you that the opinions voiced in this program do not necessarily reflect the views or opinions of the AFCC, its staff, volunteers, board of directors, or underwriters. And we got an event coming up.
Yes, so save the date for May 28th from 2 p.m. to 5 p.m. at the Martin Luther King Park in Oroville. The Breaking Bread Cookout is something you won't want to miss. Bring your family, friends, and local activists and come learn about Black student unions while chowing down. All are welcome. If you would like to RSVP for this event, please call the center by May 15th at 530-532-1205.
And we have Each One Teach One, our after-school program for grades 2nd through 12th grade. And that is Monday through Thursday, 3 p.m. to 5 p.m.
Then you have Soul Sessions Through the Eyes of Us, which you are watching right now, 5 p.m. to 6 p.m. every Tuesday.
And we have a behavioral health counselor that is in the center offering drop-in services Tuesday and Thursdays. Just give us a call and let us know you'd like to meet up with her.
And we also are offering Personal Peace Institute, which is a free program via Zoom that provides participants with the skills and strategies necessary for recognizing and controlling angry feelings. For youth, that is every Wednesday from 5 to 6, and for adults, that is every Wednesday from 6 to 7. We'll see you there.
And we have our new support group called Parenting for Success. That is every Friday from 5 to 6 p.m. And the class is available in person and online. The first 5 people to attend 10 classes will receive a gift card.
If you like to pop, lock, and drop it, come visit us every Friday from 2:30 to 5 p.m. We are having a hip-hop class called Dance Diverse that allows participants to build relationships, learn leadership skills, and boost confidence.
History Right Now is a radio show every Wednesday at 10 a.m. with Jalen Whitaker, the project coordinator. Check that out on KOYO.
Make sure you're tuning into your local community radio.
Please give us a call at 530-532-1205 if you have any questions or you want to sign up to participate, volunteer, or facilitate any of these programs. And next week we're going to be talking about stress management for African Americans. We'll see you next week.